Hi there, it's Tuesday, May 21st. It is journal, what is it? It's journal 55, T+49, which is exciting. An eventful day. All things taken into consideration, it's a day that started at dark 30 this morning when I had to get up to prep for yet another procedure. I've been, I'd say, plagued with diarrhea, which is not terribly pleasant, as many of you already know, almost since the moment I entered the hospital. Turns out, we found out today after being prepped and then showing up at the hospital for a Flex Sigmoid, the violation of yet another orifice, that whatever else I might be suffering from with regard to this problem is C-Diff, which is a hospital-borne infection. It's particularly nasty. And what makes this really interesting, and a lot of you have probably gone through this, not the majority certainly, but maybe enough so that you'll understand, is the diagnosis was difficult because I had a lab sample already taken care of, and it came back negative. So there's an argument for doctors with experience and ability going in and actually seeing what they're looking for, and that was the case with our doctor here at the City of Hope. We're going to wait for the rest of the lab results, which should come in end of the week, maybe Thursday or Friday. I won't see them until Tuesday, if that's the case. And that would be whether or not we're talking about graft versus host disease and different sets of antibodies, those that belong to the stem cell donor and my own, deciding to wage a war. And what makes that interesting, and certainly would be more interesting if it wasn't happening to me, is the fact that the donor that I have was a 12-point donor, which is unheard of. It's just almost, as you know from many of the earlier journal entries, it's just, 10 points considered the best. And 12-point is just unheard of. And then a 12-point donor with the same blood type is crazy altogether. I'm not even sure what the odds of that are, but they're significant. So, you wait to hear, not knowing what they're going to do. And, there is some anxiety associated with that lack of knowledge, without knowing where this is going to go, how it's going to end up, what's going to happen. And you cope, you deal with it. What else are you going to do? Right now I'm on a heavy duty medication, and I was terrified to take it. And it is an antibiotic, vancomycin. And the reason, normally I'm not afraid of medications in general. I try to find out what the side effects are, because all of us should really know that before we take it, so there are no surprises. But my dad, when he was ill, he also had contracted a hospital-borne infection, a methicillin-resistant Staphylococcus aureus, an MRSA infection during heart surgery, which was supposed to guarantee him a solid, good 5 more years of productive life, and wound up taking his life in 10 months. The MRSA infection is also heinous in the way it works and its resistance to normal antibiotics. And in the course of, like me, he's allergic to penicillin, or I'm like him, I'm allergic to penicillin. And they gave him vancomycin also. And I found out something interesting because I was really, as I said, I was really reluctant to take the drug because of what happened to my dad. And that was he began to lose his hearing. And I mean, seriously, it was a serious hearing loss. And I was terrified of having the same fate. So I already have a high frequency hearing loss from using all of the air tools in the shop and the noise and street racing and drag racing and being around, uncorked hot rods that made a lot of horsepower. And I found out something that was interesting about that, and maybe you should file that away, is that vancomycin, when taken orally, does not have that impact, doesn't have that effect on a patient. Taking it intravenously, however, can result in a hearing loss. I thought that was really interesting. I don't know why, but it just did. So we wound up getting that done, and then you take a Propofol nap, and you wake up in another room, and that for a microsecond, for an instant, you're sitting there trying to figure out where you are and how you got there, and then all of a sudden you're awake. I mean, you're just perfectly awake. Just the strangest damned anesthesia, there probably is, and with few, if any, residual effects. They won't let you drive afterwards because you can be a little bit goofy, you can be a little bit drowsy. So my wife came and scooped me up after she went and had to have blood tests so that she could go ahead and go back towards our house to her regular doctor to get an EKG, a pre-op workout, so she could get her epidurals, which nobody told us about in the beginning. We should have known it, but we didn't, which complicated her Friday. It's also probably complicated a lot of other Fridays for other people in our family. However, we came home and the rest of the afternoon is kind of shot because I don't know about anybody else, but I took a nap, and it seemed like the most intelligent thing to do when you wake up from the anesthesia and you feel fine, and then a couple of hours later you're really zonked. And I'm not sure whether that was because of the anesthesia or whether it was just from waking up at 4:30, 4:45 in the morning. But the one thing that was cool, I thought, was that really made my whole day was that I had blood work done yesterday because it was a normal clinic day, so I know what my numbers were for yesterday. And because my platelets were borderline, they decided to do another CBC panel, which gives you red blood cells, white blood cells, platelets, all kinds of stuff. And my platelets had actually gone up by 10 points, which is kind of unexplainable because usually that would happen after you get after you get a transfusion. But mine were up 10 points. Now, I go back for clinicals testing again on Thursday, and it should be interesting to see where they go from there. Certainly hoping that they in fact keep increasing, because that'll mean that the graft is really starting to pay off. So tomorrow is a free day, so it'll be interesting to see what kind of trouble we get into tomorrow. Hopefully I'll be feeling better and are feeling well, and the antibiotics will begin doing their job. And, within 10 days, everything should be fine. So I'll let you know how all of that works. Until that time, stay well, take care, know that we care about you a great deal. Look for you here tomorrow. Bye-bye.